I want to welcome everybody to our webinar. It's the other malnutrition, unintended weight loss, the other malnutrition. Kara Burns is going to be our presenter. I'm going to start by introducing her, and then we're going to talk a little bit about making a donation. Every Cat Health Foundation, remember, research saves lives, and we cannot fund research without your help. So keep that in mind. There will be a QR code. Otherwise, I will put into the chat a link that you can click on if you want to make a small donation or a larger donation if you prefer. So let me get started here with Kara. Kara is a licensed veterinary technician with a master's degree in physiology. We've been with that before, and a master's degree in counseling psychology. She began her career in human medicine, working as an emergency psychologist and as a poison specialist dealing with human and animal poisonings. Kara is the founder and past president of the Academy of Veterinary Nutrition Technicians. She teaches nutrition courses around the world. She's an independent nutritional and well-being consultant and is also the editor-in-chief for Today's Veterinary Nurse. She's a member of many national, international, and state associations and holds positions on many veterinary boards, including Every Cat Health Foundation. She's also on the board of the Western Veterinary Conference, where she's Technician Education Manager. She is past president of the National Association of Veterinary Technicians in America. She's currently Every Cat's president-elect, and she's the first technician to be the president of the Pet Nutrition Alliance. And that's just to name a few. Otherwise, we could be here for an hour just talking about her accomplishments. She's authored over 200 articles, textbooks, and textbook chapters, and is an internationally invited speaker focusing on topics of nutrition, leadership, communication, and technician utilization. Kara and her wife, Dr. Ellen Lowry, developed the Pet Nutrition Coach certification courses through NAVC, or the National NAVC, VMX now to veterinary people. Kara shares her house with a menagerie, including dogs, birds, and of course, cats. Kara, take it away.
Wonderful. Thanks so much, Virginia. And thank you all for being here. I greatly appreciate you spending some time with us, and a huge shout out to Every Cat for putting this session on, and for putting on quite a few different educational sessions. So I'm honored to be here to talk to you about. We talk a lot about, and we should, weight management in cats. So I thought it might be interesting if we talked about the other malnutrition, which we now know to be unintentional weight loss. And Virginia also mentioned that Every Cat Health Foundation, really our mission is to advance feline health by supporting groundbreaking research and education. Every single cat, every single day benefits from our foundation, and our foundation benefits from donors and you know all of us that are here now. So think about, if you can donate, wonderful. Virginia put together a little QR code, mainly because I have no idea how to do those things. But really, thank you for supporting, even by attending this webinar. We all appreciate your support. We know that research saves lives, and that's what we are all here for, right? To learn more about how we can manage cats, how our veterinarians and veterinary teams can treat them, and how we as pet owners can help to manage and extend the length of that life. So without further ado, all right, I think you've heard enough about me. So let's get right to it. Unintentional weight loss. So, you know, what we're talking about First is diseases that affect caloric intake and absorption of nutrients across the gut, and how the physiology of that cat is utilizing those nutrients. And so with that, we need to start investigating what is happening if we are seeing weight loss that, in what we all, be it the veterinary team or the cat owner, um, thinks is an otherwise healthy cat. But then we start to see, hmm, they seem to be losing some weight. So what's happening? Well, we all, as a team, need to begin investigating that. And so, protein turnover increases in older cats, often causing a matching loss of muscle mass. So, the cat loses weight with aging. However, in cats, this weight loss involves both lean and fat mass, resulting in an overall body composition that again doesn't change dramatically, and this is why it's sometimes hard to visually notice the change. This decline in body weight is important for the veterinary healthcare team because if we look at cats that have died of cancer or chronic kidney disease or even hyperthyroidism, those cats were reported to have lost weight for 2.5 years. So gradual, but for 2.5 years prior to their death. Whereas cats dying of other causes lost weight over an even longer period. The point being, we need to, all of us, cat owners, cat veterinary healthcare teams, we need to start picking up on this weight loss as soon as possible. And one way we can do that is with body condition scoring. And we're going to talk a little bit about that in just a little bit. But if we look, here's a study that was done, and it was found that strong associations of body condition scoring correlated with survival and lifespan in cats. And so the impact of unintentional weight loss, this weight loss can affect all ages and sizes of cats, young, old, small, large, even cats that are overweight to begin with. It's an early indicator of disease, especially in our geriatric cats. And that's kind of what we were just talking about. It also has slow onset, which we've determined. And again, cat owners and yes, cat healthcare teams may not be concerned or may not notice until other clinical signs are noticed. And unfortunately, by that time, the cat may be significantly ill. Also can lead to a poor body condition score, which is associated with decreased survivability and lifespan in cats. A body condition score of less than 6 out of 9, those cats are as much as more than 4.5, 4.7 times at higher risk of death. So, body condition scoring, I've been saying this for 30 years or so, but body condition scoring, and we're going to talk about muscle condition scoring, is crucial when we are managing cats and when we're monitoring our cats at home. This isn't something that is only done in the veterinary hospital. We as cat owners can also body condition score, and we should. So, the clinical impact of weight loss can be profound, right? We see prolonged inadequate nutrition, and this inadequate nutrition can be more detrimental to the patient than the disease process itself. Organ dysfunction, such as hepatic lipidosis, we may begin to see that. Immune system dysfunction, prolonged hospitalization, increased cost of care, and increased morbidity and mortality. which leads to decreased survival and longevity. Proper nutrition and picking up on unintentional weight loss as soon as possible is going to help improve these things that we see here, right? Improve immune system function, shorten hospitalizations, decrease that cost of care, and most importantly, decrease morbidity, sorry, and mortality. I kind of put them both together. So we should not wait. If it's prolonged, inadequate nutrition can result in weight loss that may lead to the development of serious clinical issues, such as I just mentioned, hepatic lipidosis. So, a rational approach to the patient with unintentional weight loss is based upon a sound understanding of the relevant biologic, pathophysiologic, and environmental factors that may be playing a role. Now, you also see another bullet point, psychological. So, you know, a change in your cat's appetite and unintended weight loss doesn't always have a simple answer. It could be from non disease related stress, like a change in where they eat. Something as simple as that. Cats like uh, consistency, right? They don't like change. They're a lot like humans, right? We don't like change. Our cats especially don't like change and become stressed, whether they show it to us or not. If they become stressed, then they may stop eating. So as I said, it could be from a change in where they eat, maybe a change in the type of food, the consistency of the food. It could also be a reaction to psychological stress again, like the disappearance or the passing of another pet, or even well, I actually already said that. I was going to say, or even, where they've been fed, but we've talked about that. um, we know that anxiety and stress in cats from visitors, right? From house moves, even just moving furniture in the house is very stressful. And again, can play a role in unintentional weight loss. So why nutrition, right? You knew I was going to ask that because you know I'm going to talk about nutrition as a way to work through and manage these cases. But why nutrition, right? Well, if we look at our pets or cats, regardless of age, there's a complex process involving interactions between genetics, nutrition, and other environmental influences. Nutrition plays a role in the health of cats, especially our senior cats, and directly affects the immune system and body composition. And so, nutrition is one of the most important influences on health and disease. We can't change genetics, right? That's already been predetermined. But we can help manage what is going on with our patients through diet or through nutrition. So I think we've all heard it said that old age is not a disease. We know that. We recognize that. And, the effects of aging on nutrient digestion and absorption, body weight, muscle mass, metabolism, nervous and immune systems, the kidneys and joints, we still have to monitor them. So old age isn't a disease in and of itself, but we know that aging can affect a number of the things that I just mentioned. So, undiagnosed or untreated age related diseases might be partly responsible for the difference between cats that, for lack of a better way of saying it, look their age or older than those who don't. And we know we've seen those cats before, right? Some are just, you know, they they're not really moving very well. They have something going on, something underlying. And then there's others that are, the same age, but they're doing well because they don't have that underlying issue. And so, we've already mentioned that aging does affect all of these bullet points that you say. So, you know, our mature pets should be routinely evaluated for age related diseases because many of these disease conditions can be managed nutritionally. And this is going to help in ensuring the patient experience improved care, quality of life, and longevity. And isn't that, why we got into veterinary medicine, or what we're hoping we can provide our cats? So if we look at the lifespan, if you will, of a cat, um, the AAFP, which is now the Feline Veterinary Medical Association, in conjunction with the American Animal Hospital Association, has looked at this, and it's changed slightly, but in the last guidelines, so the feline life stage guidelines, we now know that kittens birth to a year. That one really hasn't changed that much. Then we have young adult, 1 to 6 years. The mature adult, usually until about 7 years. And, as a testament to every one of you that has joined me today, our cats are living longer. So they're considered senior, around 10 years and on. And end of life is truly variable because of the care that cats are getting, the medical knowledge, the cutting edge innovation that our researchers are finding, and our veterinarians are implementing, and our owners are also implementing. So thank you for all you do for either your own cat or for your patients, or for both. So, an overall decline in body weight without changes in body composition is one of the main features of physiologic alterations in cats, especially in aging cats. Cats tend to gain body weight steadily up to about age 9. After this, body weight generally begins to decrease. And unlike other species, cats don't appear to exhibit an age related decline in daily energy requirement. Actually, on the flip side, it appears that in cats older than 11 or 12, there's an increase in DER. This increase is believed to result from a relatively constant low level of physical activity throughout their adult life, right? They're just not moving as much um, throughout their adult life, and lack of body composition changes. And again, as we started with, that higher rate of protein turnover. And so, protein turnover, as we know, increases in older animals, often causing a matching loss of muscle mass. So, the cat loses weight with aging. However, in cats, this weight loss involves both lean and fat mass, as as I mentioned earlier, resulting in an overall body composition that again doesn't change dramatically. So, sarcopenia is a term that refers to the degeneration of skeletal muscle mass and this muscle's quality and strength as part of normal aging. It's not associated with disease process. And oftentimes we um, first see this in our cats in the temporal area. Okay. So decrease in skeletal muscle mass, quality and strength. As I said, normal aging. Um, some of the factors are age related decrease in neuromuscular impulses, a decrease in physical activity, which we talked about, a decrease in the hormones that support muscle mass, and a decrease in the synthesis of muscle protein. So, With sarcopenia, it might be difficult to identify because the total weight may not change. Loss of lean body mass may be accompanied by an increase in adipose tissue mass. So here you see loss of muscle mass. And here you see, um, I wouldn't say this was an increase, but it didn't go away. Let's just put it that way. Here's some adipose tissue. Okay. So this is an older cat. Um, this cat was around 12 at this point, and you can see sarcopenia was happening in this cat. Muscle loss, fat gain. Now that differs from cachexia. Cachexia is a multifactorial syndrome characterized by progressive weight loss that is often, but not always, accompanied by anorexia. Unlike weight loss seen with starvation or anorexia, cachexia is distinguished by a loss of adipose tissue or fat tissue with accompanying loss of lean body mass, primarily muscle. So in cachexia, negative protein energy balance develops because inadequate nutrition combined with an abnormally increased metabolic state results in a loss again of muscle mass and body condition. Additionally, the systemic inflammatory state associated with various chronic disease processes leads to catabolism of muscle via both protein and fat degradation, as well as impaired ability to stimulate protein synthesis. So you can see on this cat how thin this cat is. Again, cachexia is loss of both adipose tissue and lean muscle. And, there are a number of reasons for that. But if we look at stress starvation, right, what we see here is the inflammatory response triggers alterations in cytokines and hormone concentrations and shifts metabolism towards that catabolic state at the onset of injury or disease. Think about this. We see it often in cats with cardiac disease, cancer, chronic kidney disease. Okay, so what we're seeing is a stress starvation. And with lack of food intake, right? These guys feel lousy. They don't want to eat. And so, with that lack of food intake, the predominant energy source is derived from accelerated breakdown of endogenous proteins, which in itself is an energy consuming process. So, these animals may actually preserve fat deposits in the face of lean muscle loss. In these patients, early nutritional support is essential since feeding spares endogenous proteins, which is critical to successful outcomes. And so, what are some of the consequences of inadequate nutrition? Well, impaired immune function, impaired tissue synthesis and repair, which we just mentioned. And the medications that our veterinarians are prescribing, if they're not getting the right nutrition and are losing a great deal of weight, and we already see impaired immune function, then the medications that our veterinarians are prescribing aren't able to be metabolized properly. So now let's turn to malnutrition. So when we are assessing cats for weight loss, it's important to consider all components of body composition. Okay? So what those are, we need to consider body weight, body fat, and lean muscle. And I think by this point you've pretty much picked up on that, right? Because that's what we've been talking about. So to maintain body weight, it's crucial to provide adequate caloric intake, maintain reliable absorption of nutrients across the gut, and ensure efficient utilization of nutrients and energy sources. And so if we wanted to, basically see the glossary, right? What right? Hyporexia is a reduction in food take. Anorexia is different. That's a loss of appetite. And we see that often again in our cachectic patients. Not only, but that's a telltale sign with our cachectic patients. So thus we need to provide adequate caloric intake to help maintain consistent nutrient absorption and ensure efficient utilization of nutrients and energy sources. A day or so of inappetence in general is not particularly detrimental to an otherwise healthy cat, but prolonged inadequate caloric intake results in malnutrition, again, reduced um, immune function, and it's an increased risk for hepatic lipidosis. Anorexia, again, can be caused by stress, unacceptable foods, concurrent disease. Most commonly, cats presented to the veterinary hospital for anorexia have concurrent disease. But we are going to talk about, some of these unacceptable foods and stress. So this one this one always surprises me because I've heard it a lot throughout my life in veterinary medicine. But what I want to remind everyone of is that cats will endure prolonged starvation rather than eat an unpalatable food. So cats, if the food is unpalatable, they're not going to eat it. They're going to walk away. And so advising owners that a cat will eat when gets hungry enough, no, that has deadly, deadly results. So we are going to work to get nutrition into these guys, especially exogenous protein sources, so the cat is not catabolizing their own um, muscle mass. I hope that makes sense. So adequate absorption and efficient utilization of nutrients from the gut is a significant piece to maintaining optimal body weight. Diseases that alter GI integrity, absorptive capacity, gut motility, or general function may contribute to unintentional weight loss. The presence of infectious organisms or alterations in normal microbiota can also result in changes in the structure and function of the gut. Failure of nutrients to cross the gut wall at a normal rate may be associated with diseases that result in maldigestion or malabsorption. Failure of normal absorptive processes then result in the inability to maintain body weight and ultimately weight loss. Disease states can also affect the rate of nutrient loss in the body. So I want us to understand that yes, oftentimes there is an underlying disease, but we have to watch our patients and our pets to to s- to pick up on changes in their eating habits. Um, Non-GI disease can play a role in nutrient or calorie loss. So think of patients with maybe renal disease, um, because they'll exhibit an increased daily loss of calories due to increased metabolic rate within the kidneys. Okay, so um, I hope that makes sense, and we're gonna talk now about nutritional assessment, and there will be some pearls for both veterinary team members and pet owners, because we're well, one, we're all cat owner, well, most of us are cat owners, right? um, We have a number of cat owners that are attending today and a number of veterinary healthcare team members. So thank you all. I'm just excited that we're all here because we want to help maintain ideal body weight in our feline patients and our feline um, owned cats. Feline owned cats. All right, our own cats, our own pets. So nutritional assessment. All right. We need to do a nutritional assessment on every cat every time they come in because what we have to determine is their nutritional needs. And so this is a general statement, right? Every cat, every time they come in, their nutritional needs, they might be malnourished, they might have unintentional weight loss, they may be, they may have malnutrition and they're over conditioned, right? They're overweight or obese. We need to determine that when they come into the hospital. And yes, we can do body condition scoring and weights at home. But we want to work together to come up with, to determine the nutritional needs and come up with a feeding plan and feeding goals. So a big part of that is going to be nutritional history. When we can weigh our cats at home, when we bring them into the veterinary hospital, they will be weighed. But let's talk about nutritional history, and then we're going to talk about body and muscle condition scoring. I like to ask owners when they come in what they're feeding and why, because I want to know their thought process. I want to know, what it is about a specific food that they believe to be helping that. And when I say they, it's all of us, right? So I feel I get a great deal of information when I start by asking the pet owner what they're feeding and why. And with a nutritional history, we're going to have to ask open-ended questions, right? So, yeah, tell me what Fluffy eats in a day. I like to ask, say you're going on vacation and I'm going to be watching your cat. Write down everything that you do for your cat in a 24-hour period so I do it just like you. And you're going to get a ton of information. So from that we will find, right, the brand of food. Are they feeding canned or dry or both or something else? At the feeding method, right, we're going to get all of that information by asking that one open-ended question. We want to have this relationship, the veterinary hospital and the cat owner, so there's trust built, and we are getting to the bottom of what is going to help Fluffy. Okay. Cat owners, right? We can note changes in their eating habits, right? Has there been a change in the interest in food or how much they're eating? Is it taking them longer to finish? Or maybe, they're scarfing it down where they never did that before. And so there are some nutritional histories out there. This is one in an article in the Feline Practitioner. And I just put this up there not because I wrote it, but because of this um, nutritional history questionnaire. Once we ask this a couple of times, it will become second nature, and we will have a lot of the questions answered. Because again, these are open-ended questions. There's also the World Small Animal Veterinary Association has a short diet history form, a long diet history form. I have other nutritional questionnaires. If you need anything, please let me know. My Gmail will be at the end. So, okay, so we're getting through our nutritional history. We're truly finding out what is going into Fluffy. And so, as I promised, we'd talk about body and muscle condition scoring. And the feline body condition score, this is from the 2021 AHA the American Animal Hospital Association Nutrition and Weight Management Guidelines. And so now, today, we're actually talking on this side, right? So many times we talk over here. But if we're worried and we are noticing, whether we are the cat owner or the veterinary healthcare team, we should be doing a body condition score. This is going to help us determine how much fat, if you will, is on our cat. And so, changes in body composition are common and important concerns in cats, and they need to be investigated, whether they're on the high end or the low end. And so please utilize these. And it also puts, again, the cat owner and the veterinary team on the same page. So when the cat owner calls in and says, the past couple of weeks I've been doing a body condition score on Fluffy, and well, it started around 4, but Fluffy's actually gone down to a 3 now. That is key, crucial information that the veterinary team needs to know. In addition is muscle condition scoring. Okay. And so, again, what our veterinary team is going to be doing is palpating over the spine, the scapula, the skull, and the pelvis. We shouldn't be able to see those bones, but sometimes we do. And so, you know, um, basically, a mild muscle loss, we're seeing mild fat deposits. Um, a moderate muscle loss, and let me explain it better this way. um, we want to palpate, this is normal, okay? So we're seeing normal muscle mass, and this is over a bone, okay? So with the mild um, muscle loss, we start to be able to feel that kind of concave, because it's caving in, for lack of a better way of saying it. And the worse that um, weight loss gets, um, the worse the muscle gets around these bony prominences, the more we'll be able to actually feel these bones. And this picture here depicts it better than I just explained it. So, hey, it's Wednesday mid-afternoon, and uh, I don't know, but use this condition scoring chart, and we'll go on to key nutritional factors. So, water, 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 water. Water is the most important nutrient. The water needs of cats, as most of us know, are different from the water needs of dogs because of their ancestors' adaptation to environmental extremes. Domestic cats are believed to have descended from African wildcat, which is known to be a desert dweller. So, adaptation to a dry environment may explain a few of the special features of water balance in cats. Cats are able to survive on less water than dogs, and may even fail to increase water intake at minor levels of dehydration, up to 4% of their body weight. Highly concentrated urine is formed in cats to compensate for this reduced water intake. But this strong concentrating ability, in addition to a weak thirst drive, may result in highly saturated urine. Highly saturated urine increases the risk of crystals and urolithiasis. So we basically want to make sure that cats are drinking water. How do we do that? You guys probably have as many tips as I do. Cats don't like stagnant water, so that's why fountains have become, so popular. Um, Even leaving the water running from a faucet for a little bit so the cat can go and drink. They like these things much better than just a bowl full of water. Also, whisker fatigue. Cats don't like, for the most part, when their whiskers hit the side of a bowl. So maybe we have, something a little bit bigger that we can put water into where they're not hitting their um, whiskers. Vitamin metabolism. Um, Cats don't convert sufficient amounts of tryptophan to niacin. So, animal tissue based diets have niacin. The niacin requirement of cats is almost 2.5 times higher than dogs. When we're talking about vitamin A occurs naturally, but again, only in animal tissue. This is, again, reasons why cats are obligate carnivores and dogs are omnivores. Plants synthesize vitamin A precursors, so beta carotene. Omnivores and herbivores can convert beta carotene to vitamin A, but cats can't, and they require a dietary source of vitamin A. They also require a dietary source of vitamin D. Protein metabolism is unique in cats. And if you haven't picked up already, cats as a species are very unique. That's why we love them, right? They have a higher protein requirement versus dogs. Cats are also, oh, here we go. Cats also need 4 specific amino acids, and they need this from their diet: arginine, taurine, methionine, and cysteine. So we need to make sure, again, that it's an animal tissue is provided in this diet. The protein requirement for growth in kittens is only 50% higher than that of puppies, whereas the protein requirement for adult cats is twice that of adult dogs. The higher requirement of protein in cats, it's a result of high activity of hepatic enzymes, those transaminases and deaminases that remove amino groups from amino acids. So the resulting keto acids can be used for energy or glucose production. Cats have limited ability to decrease the activity of these enzymes when they're fed low protein foods. Again, in cats, hepatic enzyme systems are constantly active. Thus, specific amounts of dietary protein are always being catabolized for energy. So, being obligate carnivores, as we mentioned, cats have a higher requirement for protein and specific amino acids. And if nutrition is not adequate, then energy is derived from mobilization of amino acids from muscle stores as opposed to fat. Again, it just breaks down to, or it comes down to, the importance of um, remembering that cats are obligate carnivores and they must have animal tissue in their diet. Vegetarian and especially vegan diets cannot work for cats. Um, Cats are also particularly sensitive to changes in environmental factors, as we talked earlier: the timing, the location of feeding, the food type, the smell, the feel in their mouth may also play in their willingness or non willingness to eat. So the digestive capacity for protein also declines as our cats age, affecting about 20% of cats over the 14 years of age. Senior cats digest only 77% or less dietary protein, much less than the normal range of 85 to 90%. So, with decreased digestive capacity for protein, in addition to increased protein turnover, senior cats should be fed ample dietary protein to allow maintenance of their lean body mass. Fat. Cats are able to digest and utilize high levels of dietary fat. Again, being a true carnivore, cats have a special need for arachidonic acid because of their limited ability to synthesize arachidonic acid from linoleic acid. So, an exogenous source, a dietary source of arachidonic acid, is especially important for more challenging life stages, gestation, lactation, and growth. But I would also say, our senior and especially our geriatric cats. The basis for this additional requirement is the low hepatic delta 6 desaturase activity in cats. Again, it's going back to their obligate carnivore physiology. So, the approach for managing feline patients that are experiencing unintentional weight loss must be patient specific. I think we all know that, right? Management and support are multimodal and should be tailored to the individual cat based on suspected underlying cause for the weight loss. There's a number of therapeutic and supportive strategies. One thing I want to remind everyone is that feeding tubes save lives. So if we have an anorexic cat or a cat that isn't eating enough to maintain, we can put a feeding tube in. These, I think most of us think these these look so bad, so they must be bad. No, cats tolerate the cats and dogs both, as well as a number of other species, tolerate feeding tubes, very, very well. And they can be used for both in hospital and at home. And so there's different kinds, right? There's nasoesophageal, nasogastric tubes, which we see here. Okay. And these are typically shorter lived. So if we want to, help with increasing nutrition in the hospital, we can certainly use an NE or an NG tube. Esophagostomy tubes are also used more often. And these are also great for owners. So if they need a feeding tube and we want to send them home with a feeding tube, you know, esophagostomy tubes are a great way to go. We can educate cat owners how to manage these. It's not, truly not that difficult. As long as we are talking and educating and our owners are asking us questions, this is a great way to help our cats. This is much easier and so much less stressful on cats, especially cats that are, malnourished and not really wanting to eat or hyporexic and not eating enough. We don't want to force feed them or syringe feed them because that is just going to increase stress in our cats and just, the cycle will continue. So think about feeding tubes because they truly do help save lives. And then there's dietary manipulation, including altering flavor, kibble shape, texture, or moisture content of the diet. I'm going to talk a little bit more about that in just a second. Cats are very sensitive to food. Again, the form, the odor, and the taste. Flavor and texture preferences of individual cats are often influenced by early experience that can affect preferences throughout the cat's life. And so I first want to mention flavors. So, flavors. Animal fat um, is very palatable, and cats love fat from animal sources. Protein hydrolysates, which are digests that are sprayed on the kibbles before they're put into the bag. So think of it as a palatability enhancer. Meat extracts, very palatable. Free amino acids found in animal muscle. These are all flavors that cats prefer. Now, getting back to these fixed food preferences and the food type, I will tell you that during the first 6 months of a cat, a kitten's life, influences the pattern of food preferences throughout life. So to help the population that we're talking about today, we need to educate kitten owners to feed different food types. So canned, dry, different kibble shapes, different textures of can, because now there's, loaf, there's this that you see on the screen, there's stews, there's pouches, there are so many. But if kitten owners are feeding just one maybe dry food, then they become fixated, and they won't, later on in life when we are trying to get food into them, they won't um accept any other types or patterns of foods. So you can still stay within the same brand. So but try some different um patterns of food, types of food, different kibble shapes, different canned formulas and shapes. It's the only time I'm pretty much ever going to tell you to mix it up, if you will. But it's very, very important when we then are seeing them for, malnutrition and or undernutrition, and we're trying to get food into them. So it's that limited exposure that's causing a food fixation. Here's a round kibble. And it used to be that this round kibble would be in kitten form, and then they would go into this as an adult, right? And into their senior years. Research has shown that this isn't the ideal way to feed cats anymore, right? Yes, you can feed a round kibble. That's not what I'm saying. But especially because adult cats like highly palatable single item foods. But what happens if we need dietary modifications later, such as our, anorexic or cachectic cats, where we're trying to get them to eat and they don't want to, try anything else. So think about that. Okay. Um, so again, that's just going back to kibble size. Moist or canned foods versus dry, different kibble shapes. So we've talked a lot about different nutritional approaches to managing um, unintentional weight loss in our cats. I am not a veterinarian, but there is one thing that I want to encourage you to talk to your veterinarians about, or veterinarians you may already, and veterinary healthcare team members, you may already be prescribing Miratraz. It's this is a weight gain medication. It's not an appetite stimulant. And that's what I hear so often. It's um it's the first and only FDA approved transdermal medication for the management of weight loss in cats. I don't work for Decra, who makes this product, and again, I'm not a veterinarian. But if we think about, we have the potential to utilize a weight gain drug or medication that we're not having to pill our cats, right? Because it's a transdermal. Then, I think this is pretty amazing. Um, so there we go. So it's basically administered topically to the pinna, so the part of the ear that is sticking up, right? On the inside or the inner part of the pinna, not the ear itself, the inside of what you see, okay? Um, and you do that once a day for 14 days. Yes, you should wear gloves, most definitely. Um, and care should be taken that you or other animals in the household do not come in contact with the treated cat for 2 hours, because again, it can be absorbed transdermally and orally. So that's just my little warning. But you know, as I've been talking about, we want to be a team to manage unintended weight loss in cats. And so the veterinary healthcare team and the cat owner should work together, right, to determine the underlying cause of your cat's weight loss. And this one product, along with all the nutritional stuff that I would do first, but but that's just me because that's my area of interest. But to have a weight gain drug is also game changing, and I've seen it work very positively in patients that I've helped to manage with a veterinarian. So so just to let you know, you can also visit mirataz.com, and it will give you either the veterinary team or the cat owner give you tons of information. So that's just a little aside, in addition to all the nutrition that we've been talking about. So, thank you guys so very much. I know that we are almost at time. This is my Gmail, so Kara M. Burns at gmail.com. If you have any questions or comments or about this or anything really. And again, I want to shout out Every Cat Health Foundation for having me here today, and for and thank you all for supporting the Every Cat Health Foundation, because remember, research saves lives. I know I said feeding tube saves lives, but research does as well. So, and there's, Virginia's brilliant little QR code. And so, so thank you all for being here, and have a
How about
wonderful rest
we
of
have
your day. Okay,
a couple of really good ones. Um,
great.
First of all, what is the difference between a weight gain drug and an appetite stimulant?
Great question. I am not a um, chemist or whatever would be to make these, but um, an appetite stimulant stimulates a different part of the brain to get the cat or the whatever species thinking that they are hungry, and will stimulate their appetite, versus a weight gain drug, which different part of the brain helps physiologically speaking to gain weight. I mean, obviously we're going to be focusing on the nutrition aspect that I was talking about, um, to make sure that they're eating. But uh, I know a lot of people think of Miratraz as an appetite stimulant, where it isn't. It helps physiologically for that cat to gain weight. And if you visit miratraz.com, they can give you an even more in-depth um, explanation of how their specific weight gain drug works.
Um, a question from a rescuer in regard to feeding kittens and making them, less neophobic about different foods.
Yep.
First of all, what recommendations do you have for that in terms of different types? And you did talk about that a little bit, but then the other question was, how do you prevent GI upset that goes with changing food?
Yep. Great questions. So I typically stay within a brand. So whatever brand your rescue uses and believes in, whether it's Purina or Hills or whatever's out there, each brand will have different offerings. So they'll have different can flavors. They should have different canned textures. So some might have a pouch, some might have a stew, many have a loaf, which is that just means it comes out. It's a can formula, but it comes out looking like the can. And if we stay within the brand, then we have less GI upset because of the way that each brand formulates their food. If you went from one to another, if you went from like a Hills kibble to a Purina Pro Plan kibble, then you're more apt to get GI upset. Whereas if you stayed with a Purina Pro Plan star shaped kibble and then you went to a Purina Pro Plan round kibble or fish shaped, you'll have much less percentage of having GI upset.
And on that same note, can, well, I would, if you're going to feed a mixture of dry and canned, is there some place that they can get help to make sure that, since there's such a difference in the caloric content of
Yep.
each, making sure that they're adequately meeting that kitten's nutrition, especially under 6 months? Is there some place they can go to get help with that?
Absolutely.
Obviously they're veterinarian, but
Yeah. First and foremost, your veterinary hospital. Um, the company should have a 1-800 number or some contact information both for the veterinary team and for the cat owner. And I also gave you my Gmail, so you can always, ask me, and I can calculate out how much they should be eating. But there are a number of places. For again, first and foremost, our veterinary hospitals want to talk to you about this, and they are the experts. Secondly, the pet food manufacturers, they also want to talk to you about this.
excellent. Okay, great, great. Okay, so we're over time here a little
Yep.
bit, and with respect to your time, Kara, I just want to make sure that if you do have any questions that we didn't get to, once again, KaraMBurns@gmail.com. She's If you have questions about your own cat's food, whether it's kitten or not, Kara's awesome at creating a nutrition profile. um, I don't know about the rest of you, but reading the bag sometimes just gives me a headache. And it's really hard to determine, am I feeding an adequate amount or am I overfeeding, which is usually the bigger issue
Right.
because you don't want to underfeed, so you overfeed. So yeah, it's important to be able to understand, that you're providing the appropriate amount of nutrition for kittens and for cats too. So
Yep.
one other thing about the unintended weight loss, a lot of clients will say, "Oh, he's just getting older, so he's
Yep.
losing weight." That's not right, correct?
No, you are absolutely correct. Many times owners attribute many different things, and actually a lot of the disease conditions that were mentioned to being older. And that's no, older cats should not be malnourished and extremely thin. We know that their nutrient needs change as they get older, so we can work with cat owners to make sure they're getting the right nutrients in the right amounts. But no, weight loss is not something that we should see in our older pets. Um, lameness, so many different increased thirst, right? Those are all symptoms that are telling us that something is wrong, not that our cat is old. So great point, Virginia. Thank you.
All right. I'll never forget the cat that came into our clinic. Was just emaciated, and the owner was like, "Oh, he's 17. I think it's time." And turned out he had a thyroid problem.
Yeah.
Within a week, it was a totally different cat that they
Yeah.
wanted to euthanize. And so that was, again, weight loss is not, if it's not intentional, you need to know why.
That's right.
So,
Yep.
all
So
right.
thank you.
Thank you, Kara. Thank you so much for your time. And as I said, don't hesitate to reach out to Kara. She's she's always willing to help. That's one of my favorite things about Kara. Is she's always willing to help. Thank
Yeah.
you.
So no, thank you. Thank you all for being
Thank you very
here
much.
with
This
Virginia and I appreciate it.
So this recording will be available on our YouTube channel in a few days. And then also, this is not a race approved presentation, but I can provide certificates of attendance if you need that. So send me an email at webinars@everycat.org, webinars, plural, @everycat.org, and I can get you a CE certificate. So, or I'm sorry, a certificate of attendance if you need that for anything. So, all right. Thank you, Kara. Have a
Thank
great
you.
day.
Thanks everyone.
Thank you, everyone.